All right, folks, we continue on Smile. Jamaicans are always happy when we get health assistance, and thanks to the Duncan Tree Foundation and a surgical group from the United States, 8 more lives have been changed for the better. The founder of the foundation, Wida Duncan, has brought along with her orthopedic spinal surgeon at the Norwich Orthopedic Group in the United States, Dr. Kenneth Panessa, and senior medical officer at KPH, Dr. Patrick Bursey. Tired. Good morning to you all. Welcome to Smile Jamaica. Welcome back to Jamaica, sir.
Thank you.
Wida,
Yes, sir.
why did you start the foundation, and why is it specific to scoliosis? Is it specific to scoliosis?
The foundation is specific to non-communicable diseases.
Okay.
And we initially started with prostate cancer, and a year and a half ago, we moved on to scoliosis because we understood that there was a huge need here in Jamaica, specifically at KPH.
Okay, why you started it in the first place?
Because there's 3 main reasons. One of them was because my grandfather, who I found out recently, died at KPH because he didn't get his hip implant purchased early enough to get his surgery. So, and KPH doesn't necessarily have the funds to provide the implants, or the family has to go and purchase it and bring it back. So that was a devastation for the family, and I wanted to see what I can do to help.
Sorry about that.
But we are on to scoliosis now. We are trying to make something, we're trying to fix the situation. Dr. Bursing, for those who don't know, what exactly is scoliosis? What are we speaking about here?
Well, scoliosis is curvature of the spine. And of course, there are other, because of structural deformity, cosmetically, of course. But the other thing is causes also spinal, nerve injuries. Dr. Penos probably is a specialist in scoliosis, probably could explain more about that.
This is what we're looking at.
Take us through exactly what happens, Dr. Panessa. So I've been diagnosed with scoliosis, but what are some of the implications for me then going forward? What can happen?
Well, you basically have to say that there's 2 types of scoliosis. In the one that we're taking care of now would be in teenagers, so that's called adolescent scoliosis. And most of the time that's actually something that is probably inherited. I mean, we're finding more and more that it does run in families, and in teenagers, as they start to go through their growth spurt, if they have the particular genes that will cause scoliosis, their back will just start to curve. And if there's nothing they're doing wrong. We get asked a lot whether that's because of wearing backpacks and things like that, but honestly, it's their genetics. And that's different than what we see in what we call adult scoliosis. Someone my age may start to get arthritis in my back and then end up getting pain, and that can end up causing scoliosis.
You mentioned genetics, so in no way does diet or nutrition contribute to this?
No, diet and nutrition can have some play. As teenagers are growing, if they're not given enough milk or calcium and their bones are softer, that could definitely affect it. There is some interplay with what we see in the United States, unfortunately, is the epidemic of obesity. And even in teenagers, that can contribute to the scoliosis.
Yeah, Wida, this is the 3rd time. You had 2 first, then you had 6, and now 8. What were these youngsters chosen?
There's a waiting list at KPH, and he is in charge of that program. And he's identified the patients based on how long they've been on the waiting list, their age, and the need. And some of them have more severe curves than others.
How many on the waiting list?
There are over 300, as far as we know, 300 adolescents.
Approximately 300.
And that is why? Because they can't afford it, they don't have the equipment, why? No?
Well, there are multiple factors, but the main thing, Dr. Neil is probably the only person who does scoliosis surgery on a regular basis. And the other thing is that the implants that we use for the scoliosis, the correctness, is really extremely expensive. Probably approximately $1 million Jamaican per patient.
Okay, and this money would come from the foundation, but where would you get the money from to
Well,
provide
the
all this?
implants are donated by Medtronic. They're one of the largest suppliers of medical devices in the world, and they've been very, very generous, and they've offered to donate up to 25 cents per year.
Okay. Dr. Kenneth, I know you're going to do surgery, but say you didn't have to do surgery. Can it be treated and they get back to normal without surgery, or no?
Depends on how severe it is. The curvatures, if they're caught early enough, say 20, 25 degrees of a curvature, that can be treated while the teenager is going through the growth spurt with a brace. And the problem is a lot of these braces, the children have to wear it basically 23 hours out of a day. And in a climate such as Jamaica or any place warm, wearing a brace, if you're in school and it's not air conditioned, can be, as you can imagine, quite difficult. But typically, if the curves start approaching 40 or 50 degrees of a curvature, that's when we have to say it's just going to keep getting worse as they get older.
Yeah, we were talking earlier. I have slight scoliosis. Any hope for me, or I'm too old to be corrected? And I'm being serious about that.
No, as I said, there's a difference with pediatric versus adult. Pediatric scoliosis, or in teenagers, is about 3 out of 100 people have it, but most of them will not need surgery. In adults, actually, by the time you're 70, almost about 20% of the population has a small curvature.
20%?
20, yes. And that's because of just with arthritis as we get older, our backs
Men
wear
and
out.
women, by the way? Men and women? Or?
Men and women as adults can get it, yes.
We're highlighting pediatric scoliosis this morning based on the patient selected. I'm a parent. I'm at home and I'm watching now. What do I look for in my child? How do I run my finger along? What do I check for?
Well, there's a couple of signs, and in many times the pediatricians or the physicians that are seeing teenagers while they're growing will look for if their shoulders are level, like when you're standing up, are their shoulders level, and also you look at the rib cage. As your back gets curved, it also gets twisted, so that when you have a teenager that bends over, and the test that we do to check them in, say, clinic is to bend over, and you'll see the ribs will actually be abnormal. So one side of the rib cage will be pushing up more, and the other side will be pushing out. So it's actually a twisting motion of their spine.
We go into surgery. How long is this going to take you, Doc?
The easiest ones take about 4 hours. The larger the curve, the surgery takes longer. So in some cases, they can take 7 or 8 hours for one patient. And that's one of the reasons of trying to be able to not have these waiting lists be that long. Because in 2 years or 3 years of growing, what could be an easy curve, a 40-degree curve, could turn into a 90-degree curve.
Which would be an 8-hour surgery.
Yes, and it's been proven that the complication rate for the surgeries and the price for the whole hospital goes up because the patient's in the hospital longer.
That's your team on the screen right there?
Yes, that was the team that came down in November of last year.
Okay.
We have 2 new team members this year, and the team is growing exponentially.
Okay. Why are you involved in this, Doc? How did you get involved? How did you...
Well, I've actually been volunteering overseas for almost about 12 years. Dr. Ohanaba Buwachi, who was a surgeon from New York that Ms. Duncan had come down a year ago, had asked me to become involved with volunteering overseas about 12 years ago. So I've been involved in Africa, in Ghana, in West Africa, in Ethiopia, and East Africa.
So there's really no financial reward in this for you?
God is good. I mean,
That's right.
Really. I mean, I'm just happy that I'm able to share my skills.
You mentioned earlier, and so we're going to highlight it, but individuals lose a lot of blood for the surgery, and there is something happening this afternoon at Hotel Four Seasons.
That's right.
You can just run us through it very quickly, Rita.
Sure. From 5:30 p.m. to 9, if you're a medical doctor or nurse,
even a
phlebotomist, for the physiotherapist, we're hosting a blood management in surgery lecture, and you get 3 CME credits if you come to the lecture. And we do this is the 3rd series that we're doing, and Dr. Neal helped to organize it, and quite a few local doctors will be presenting today, and in addition to them, Dr. Pinnes and Dr. Lee will be presenting.
Thanks a lot for coming in. Founder of the Duncan Tree Foundation, Rita Duncan, orthopedic spinal surgeon at the Norwich Orthopedic Group in the United States, Dr. Kenneth Panessa, and Senior Medical Officer at KPH, Dr. Patrick Hoorasing.